Most people look at electronic medical records as a money saver or as something that is going to add value to the practice. But in reality, for me as a physician, what it has done is that it has made me a better doctor. My name is Pablo Rodriguez, and I'm CEO of Women's Care. It's one of the largest practices here in Southern New England. Tonight, I have a number of local doctors coming in to evaluate the software in action.
In terms of electronic medical records, it's not it's not if you're going to do it. We all know we are going to eventually do it. And we all know that the current system of paper is just absolutely broken.
The challenges of communicating, of transferring information, of patients' charts, of insurance information, of billing, all became just unbearable for the paper process. So that's why we have decided to move into the electronic age with electronic medical records.
How do we end up here? I mean, it's not that, we're the smartest bulbs in the Christmas tree. It's because we saw an opportunity when Blue Cross was looking to test this quality counts program, where 10 practices were selected to, in essence, just give Blue Cross the ability to examine our practices electronically. And they gave us money for it, so it was not a bad deal in that respect. And at the same time, CareTracker was in the beginning of the development of the electronic health records. So one thing led to another, and we were able to participate in the program.
We've been using CareTracker for over a year now, and it has been a real improvement in our workflow, in our billing, in our management, and we plan to continue using it for a long time.
The work that we've done with CareTracker as a beta site has been, we built the initial templates. We developed with them the bridges to women and infants, to some of the radiology places and others. We created some of these quality reports, an order reconciliation, to be able to match the order when you order a test and when the result comes back, which is very, very important for malpractice insurance. At women and infants, we get a credit in our malpractice premiums in order to, if we have this kind of a system that reconciles orders with results.
We were afraid of going into electronic medical records because we thought that we were going to be spending a lot of money and not getting an immediate return. The surprise to all of those in our practice that were non-believers about electronic medical records is that we started saving money immediately.
I never knew. Never knew. I've been managing this group from the beginning, and I never knew that we spend close to $40,000 a year in new patient charts. The files, the liners, the papers, the clips, $40,000. And how do we know that? Because we get it from a single vendor. And that vendor always sends us a big basket at the end of the, for Christmas, it's the best basket that we get.
It is about money. If you are concerned about spending money on an electronic health record system, then this is the time to get involved. The economic stimulus package of President Obama is going to go away in a few years. So if you don't prepare, if you don't begin the process immediately, you're going to miss out on the opportunity of having someone else finance this expensive proposition.
This insurance pay for performance is coming. It's already here. They're just playing with it in terms of doing chart reviews, but in a couple of years it's not going to be available for those who cannot deliver the information electronically. The Medicare and Medicaid withholds are already announced, so you know that if by 2016 you're not fully electronic, you're going to start getting paid less for the same work. And paper pushing is costly. That's the other thing that we have discovered after just a year of using the electronic health record. These are the numbers, When it comes to the dollars and cents, I want to make sure that I know exactly how much money I can get. Medicaid providers can get $48,400 and Medicaid up to $63,750, especially if you're in an underserved area. That's what gives you the bump up.
It doesn't mean that they have to begin using electronic medical records tomorrow, but they have to start thinking about it, organizing themselves, developing a plan of implementation, so when the time comes, they are prepared to do it in a very efficient and in a seamless way. It is also important for providers to know that they need to do this in a gradual way. There's no point in becoming a hero and becoming competent and completely electronic overnight. A gradual process would allow for providers, for staff, and even for patients to have a more smooth and simple transition.